Everybody, Dr. Rob here, Facebook Live, doing it a little later, got stuck on a webinar. Thanks for checking in. We covered so many different topics, and as a chiropractor who likes to consider himself specializing in functional movement and functional medicine, we've never talked about lower back pain. 8 out of 10 Americans have lower back pain. It's a $765 billion industry. I mean, if we as chiropractors and manual therapists and even functional medicine doctors considered and just looked at lower back pain, we would be busy and having a waiting list practice. Now, the reason that lower back pain really comes to mind is I hurt my lower back. I hurt pretty good. I'm feeling good now. I heard it last Tuesday night. I did what they call a Metcom. So it was a 30-minute time where I would do 25 push-ups and then take a break on the odd number. On the even numbers, do 25 swings. So odd and even. So at the end, I would have 250 push-ups done in 30 minutes and 250 swings. Felt great. Did a couple of exercises after. Warmed up, cooled down, the whole 9 yards. Now, I have congenital torticollis. Everybody knows that because I always lecture and tell everybody about it. So clearly I got one shoulder higher than the other. There's got to be some compensatory stresses put on my lumbar spine. I have injured my lumbar spine in the past. No MRIs, never had sciatica, anything like that. Wednesday morning, I woke up and I was in pain. Pretty good with a pain scale. Pain was a good, solid 8. Some back stiffness, range of motion. I could not bend forward. I could give extension, but I couldn't bend forward. It was pretty painful to come to work and try and help other people when I was debilitated, or virtually debilitated. So I've been seeing a chiropractor. I want to talk about what treatment I did, because it's stuff that I did for me that I would clearly want to share with you out there, and let all the prospective patients know I kind of feel your pain. I went through it. It's not my first time. And, getting an injury and really understanding what the ache means and the pain means and where it is and things like that really just reiterates to me what patients are going through. So not everybody out there thinks we as doctors or myself are myopic and only see it one way from the doctors. I am now being treated by a chiropractor, and I am a patient. And I am using all the things that I recommend for myself and for my patient. So let's talk a little bit about the problem. It was kind of an interesting epiphany too, talking to my chiropractor, who has been my chiropractor. He's the reason I'm a chiropractor, because he changed my life. Like everybody always reminds me, after he treated me, I got up, and the Mark Twain quote comes to mind: 2 most important days of your life, the day you know why and the day you were born. I knew that when I got treated by him, I wanted to be a chiropractor. Fast forward 30 years later, 18 years into practice, etc., I am a chiropractor and, talking to you guys on Facebook Live. And he said to me, you got some herniated discs there. It's pretty clear at this point at my age, 50, over 50, and multiple back injuries. And I took, for a second, I stopped and like, me? Are you crazy? I was the patient. Yeah, obviously I have some herniated discs. We're going to try and get an MRI. It's localized in things. 1/3 of Americans have herniated disc without pain. Obviously, unless you rip into the outer third of the annulus, you're not going to get any pain, because the disc is innervated. The annulus in the outer third, it's innervated by the recurrent laryngeal nerve, or, John's eyes just lit up. He didn't know I knew that, sorry. So it's typically posterior lateral, or it's also called synonymously the sinovertebral nerve. So clearly I want that area to hear, because the idea of a disc periphery, that's how I do a disc. There's the nucleus, there's the annulus, and the outer third of the annulus has all the nerves. So when you explain that to patients, you like to do that. You don't need a model. In addition, a couple of other ways I like to explain a disc injury to patients is very simply the tire. You have a full tire on the car and everything moves and the tread is good. You start losing some air, it flattens, and you get a little compression in your lumbar spine. Or the jelly donut. Here's a jelly donut. That's what your desk looks like. You squeeze out the jelly like that, and the disc shrinks and you have a decreased space. Remember, if I were to give a graphic representation or an evocative representation, the disc is not like hard cheese. It's more like soft jello that's just been melted. So when that stuff leaks out, when it's exposed or damaged, you have an impure inflammatory response like I was going through, and that's deeming pain, because that nucleus, which is all gelatineless, when it's exposed, it's foreign. The body's not supposed to feel that. So therefore you have that autoimmune anti-inflammatory response. That puts you on the road towards arthritis, because osteoarthritis is the body's response to inflammation. So with that being said, what treatments did I receive? I received some spinal manipulation, which is considered one of the best choices for lower back pain. Remember, February 13th, we've got that Annals of Internal Medicine that talked about spinal manipulation being a key component towards overall lower back health. Spine Magazine in 2013 also talked about chiropractic as the #1 choice for lower back health and performance and outcomes, 73% effective, JAMA 2014. So that's one of the reasons that I'm going to the chiropractor. We did not adjust the lumbar spine in rotation because since the shearing of the swings, that shear seemed to have lighted me up. My discs didn't like so much shearing. Shearing's like this. The doc decided, I'm not going to put you in sideline for 3 or 4 days. We adjusted in different manners. In addition, we used low-level laser therapy. I did it in my office. I got on the same FX 635 made by Arcona. Big shout out, guys. If I never thought it worked, I always knew that it worked. Now, intrinsically, I couldn't believe how well it worked. I got on there, and my pain level went for a duration of time from an 8 to a 1 in 120-minute sessions. So without that laser, man, I wouldn't be standing here. I wouldn't have been able to help patients. I wouldn't have been able to go to Toronto last week and lecture, and I wouldn't be able to get at Integrated Health Symposium this weekend because I'm feeling 75% better already. So the FX 635, the laser, is a great choice. Coney, a big shout out. Thanks a lot. And then he did some soft tissue work, a little different than I do, but the soft tissue work, of course, that I recommend is active release. And we did a little instrument-assisted soft tissue. Big shout out to Todd Riddle at Factor PM. What a great choice to break up some of the fascial adhesions, because my lower back was really tight and that fascia with the saran wrap body got really tight. So that was a great choice. A little spinal decompression, just to open and traction the discs to get a little inhibition, because by moving the discs like that, we were able to get nutrition into the disc and make it feel better. So we did all that. I did core activation. So what happened was, I'm somebody who can hold their front plank for like 3 to 3.5 minutes, which is relatively decent, a proper front plank. I tried to do a front plank the day after I injured myself. I did not cave because of pain. I caved because I could not contract. I could not hold it for more than 25 seconds, which reiterates to everybody out there, the moment that you get injured, your brain shuts off your intrinsic muscles that hold your spinal cord and your core in a tight fashion and doesn't allow your spine to hold, and then my periphery becomes very imbalanced, if you will. So my core was caving. When you're unable, to engage your core, you can only hold 20 pounds before failure of the spine. So that 53-pound kettlebell, once I must have de-engaged my core and not realize it, was 2.5 times too heavy for what was going on. Coupled with the shear stress, for me, gave me this irritation to my 2 lumbar discs. And believe me, when I'm saying an 8, it was pretty bad. I mean, recommendations by a couple of patients, oh, you're in pain, you should take some Aleve and Advil. Let's not even go there. So let's talk about the exercise rehab. I did some core. I tried to brace and activate. I'm able to get up to about a 75-second plank as of last night. So we're getting there. We want to get up to 2 minutes to show that my core can engage. In addition, we did stir the pot, made famous by McGill in 2012 in the New York Times article. It's taking a physio ball and moving in this manner and that manner. No sit-ups, guys, no crunches, no leg raises, nothing like that that's going to engage my hip flexors or allow me to bend at the back. If I start flexing at my back, it hurts, guys. Real sign that a disc injury is there. I did a couple of farmer's walk, hold some very light weights, walked around because I'm trying to engage my core again and hold some weight, so therefore I can do some sort of functional exercises. Stretching, piriformis has been adversely affected, so doing some great piriformis stretches. Nutrition. What supplements am I taking? Well, my diet, so you know, is typically on point. I adhere to a gluten-free, anti-inflammatory diet. That's a critical element. Food is a potentiator of inflammation. Gluten is a key component to take out. I can't really see how anybody would want to eat gluten. Gluten means glue, sticks to your intestinal tract. 100% of people are reactive to gluten, so it doesn't matter if you're sensitive, it doesn't matter if you're celiac, it's not good. If you're going to react to gluten, you're going to be in an inflammatory state. That's a problem. Your intestinal tract, your guts are a key element to your overall health. Direct correlation between failure in the gut and musculoskeletal. So clearly I'm very gluten-free, anti-inflammatory as much as I can do. Home-cooked meals, things of that nature. Supplements. Well, my normal supplements that I take every day are of multivitamin, multimineral, Phyto, Multi. All these that I'm recommending right now come from Metagenics, and there'll be one or two others like dynamic fruits and greens that I use from Nutridyne. So the Phyto Multi is a key component because it's a multivitamin, multimineral that has phytonutrients that allows you to speak to cells. The Phyto Multi gives 52% increase in DNA stability, really trying to increase, decrease my inflammation. Omega-3 fatty acids, a nice amount, about 2 grams of omega-3 fatty acids, great for cell membrane health. We don't realize how important the cell membrane is during injury because the cell membrane is going to allow nutrients to get in the cell to enable me to heal and kick out toxins. So it's good for nutrient ingestion and toxic egress, about 2 grams. I don't want to overdose on fish oils, and I'll explain to you why in a moment. Vitamin D, been clearly shown about 5,000 IUs to be a major choice to decrease with chronic lower back pain and lower back pain. I think vitamin D is probably something that you could see give a good clinical outcome in any musculoskeletal injury. I'm continuing my probiotics to keep my overall gut health in tune. I'm eating 3 greens and dynamic fruits and greens by Nutridyne. Like I said, I want to get my pH up so I'm not too acidic and I can get the toxic waste out and start to heal. Injury-specific nutritional supplements now. Number one thing I'm taking is specialized pro-resolving mediators, SPM. I'm taking 8 a day. I'm taking 4 in the morning and 4 at night. I will be at, once again, Integrative Health Symposium speaking on Friday, one of the few chiropractors ever to lecture. We have a full house, and I'll be talking about the resolution of inflammation. I'm not talking about it, I'm living it right now. So those SPMs are a major breakthrough. SPM should be the conversion from a fish oil. We have to resolve our inflammation. We need some pro-inflammation to heal. The problem when we have inflammation is that the raise is too high and it goes on and we have deficient resolution of inflammation. The SPMs, which is the next step in the conversion of fish oils, our bodies can't convert it because the enzymatic reactions are not occurring, not trying to get too heady. Specialized pro-resolving mediators ensure the resolution of inflammation and the homeostasis between the initiation and the resolution of inflammation so we have proper healing and resolution so I don't have any other breakdown structures near there and or systemically. So the SPMs have been not only a major breakthrough, they've been a godsend to my overall back health. Great choice, thanks a lot. Metagenics, we're talking again a lot about that. In addition, a product called EC Matrix. EC Matrix is great for soft tissue and cartilage and fibrocartilage. When you get injured, you release your own proteolytic enzymes, which are called matrix metalloproteinases, or MMPSs for this Facebook Live. These MMPSs come out and they chew healthy cartilage in the area. Your disc is made of fibrocartilage. So when I get injured, and these own proteolytic enzymes come out, they start chipping away and eating at my disc, and it's one of the biggest reasons why we have disc herniations. So I'm using EC Matrix to blunt the modulation of these MMPSs so they don't eat my healthy discs. And the formula, did I say something good? No, you gave me a great look. I thought I was on fire. What do you say? Am I doing all right? I got a double yes. The wife is complaining, but that's cool. Nevertheless, the formulation is a skirm. It's an herb, thea, with berberine, selenium, biotin, zinc, and a few B vitamins to enable the modulation of different pathways of MMPSs. In addition, I threw in some osteovanna, which is great for the joint. A little surprise here, alpha-lipoic acid. So why am I taking alpha-lipoic acid? You know, it works with the watering the fat part of the cell. It's great for blood sugar. My blood sugar is like 72. Alpha-lipoic acid is a hidden gem. It's a hidden gem because it blocks NF-kappa B, which is your signal transducer of inflammation. It also works through the NRF2 pathway, which enables my antioxidant protection to come up. And in addition, it also is it's anti-inflammatory. So alpha lipoic acid is something that people don't realize, and it works in a very positive manner. It's a literal, it also helps with what we call the AMPK pathway, which is the master regulator of all your genes in your body and far different organ systems. And finally, use Ultra Inflam X Plus 360, which has got probably the holy grail of herbs and xanthohumol. It's got the most bioavailable form of curcumin, which brings down inflammation. So I mix that all up, and you're looking at a guy who's taking a lot of nutritional supplements, somebody who saw the medical doctor that morning and he said, dude, let me give you a shot. I think you should go home and not work. Don't travel this weekend. Didn't miss a day of work. Traveled 75% better in 6 days. So one, I feel my patient's pain. I get it. I understand it. I'm probably going through it so I can relate better to you. Two, the protocol that I do for all the patients out there and I'm sharing with all the chiropractors, guys, it works. It works. I took everything. I'm a compliant patient. I made my chiropractic treatments. I did everything that was asked to do, and then some. I took all my nutritional supplements, and my clinical outcome in a week is 75% with 2 damaged discs where everybody thought I would literally be in bed. And believe me, I am not LeBron James in genetic outcome. I was not a Division I elite athlete. So I'm a 51-year-old guy who tries to take care of himself. So if you guys have any questions about the treatment protocol, anything within there, do me a favor and share this, because social media is great in that you can share your own experiences with everybody else. And, all about public speaking, as a little FYI, it's all about your story. So my story is I hurt my back, I'm treating it, and I want to help you with yours.
You said that you felt the injury the next day. You didn't feel it when it actually happened when you were working out?
I didn't feel it. I didn't get pop. I felt it the next day, which shows that it was a true overuse injury, and you feel it the next day. So here where you have an ergonomic stress going through a nutritional biochemistry, it took a few hours till it became present. So it's a chronic or degenerative, or like we also like to discuss, cumulative trauma. So I didn't feel it to the next day. You don't always feel it that day.
What recommendations do you have for somebody who feels it right away? Should they stop working out? Do you keep moving?
Stop
ice,
immediately.
Heat, anything?
So that great question about ice and heat. Stop immediately. By the way, it is literally 6 days later. I haven't picked up one hot pack. It's all been ice. I tell all my patients, stop with the heat. I had a patient walk in. She had a bunch of headaches, and all she was doing was heating and using hot packs. I said, stop, use ice. She said, I feel much better, but I still go to heat. I'm like, you'll feel even better. Get rid of the heat. I am not a heat proponent. I'm not a heat proponent for patients because they can conceivably hurt themselves with heat, and theoretically not with ice.
Cool. Where can people find you?
People can find me real simple. You got my Facebook Live. Look at my website, www.drrobertsilverman.com. Share this, like this. Dr. Elbow is yours in health.
Quick before you go, what's going on tomorrow night?
Tomorrow night. Where am I tomorrow? Oh, thank you for reminding me. Tomorrow night. Guys, we're going to be talking, do you have the guts to be healthy? 70% of your immune cells are in your gut. I'm going to detail a 6-hour plan within 35 minutes that any one of my patients or anybody who's considering getting themselves healthy needs to come. 311 North Street, White Plains, G1. Give us a call, 914-287-6464.
We got an after the buzzer question coming in.
After the buzzer. Let's go OT, guys.
Why not heat?
Why not heat? Great question. He causes a lot of blood circulation, and in an acute injury, he can essentially inflame the area. So it's the number one question we get. If I had $1 for every time everybody heated and used ice, I could tell you this, I would be on the billionaire list. It is a very, very common mistake. Practitioners, patients alike, try to avoid that heat in an acute condition.
Cool.
Great.
All right.
It was yours in health. Take care, guys.